If diabetes is left uncontrolled, if we don't intervene, test on time, make sure that we're screening our patients appropriately and correctly, severe complications can occur. With hyperglycemia, chronic hyperglycemia, where too much glucose is in our blood, as mentioned before, this can result in damage occurring to the smallest vessels in our body. The nitric oxide levels affected by that high glucose, the nitric oxide levels go down. This causes vasoconstriction, the constriction of these vessels, and no oxygen can get there, no blood can get there, no anything can get there, and it starts closing off the smallest vessels in our bodies first. This can primarily affect in the beginning, it can primarily affect our nervous system in the most furthest away extremities, like the tips of our fingers, the tips of our toes. It can affect the blood and the cells inside of our ears, resulting in hearing impairment. It can affect the blood cells, giving blood supply to the back of our eyes and our retina, resulting in eye vision loss. It can result in kidney damage, resulting in excessive glucose and protein coming out in our kidneys and causing kidney damage. The cardiovascular disease overall is extensive. Any kind of damage that occurs with natural hypertension or the excessive constriction with the lack of nitric oxide causes atherosclerosis to really take on. It's the fat that is rolling through our blood. It starts building up on the sides, making them even smaller. The lack of blood flow to these areas is what's causing all of these problems to occur. Without blood flow, none of our white cells or immune cells can get to damaged areas for repair. So diabetic patients that are not well controlled are exceptionally higher risk for infection. They very poorly wound heal, and infections continue to progress even despite treatment, results in amputations, extended neuropathy, losing feelings in our feet, right? How this is prevented, hopefully in the beginning, has everything to do with diet and exercise, making sure we're avoiding excessive refined and added sugars, making sure we're avoided adding excessive amounts of poor fats into our diet, like trans fat and saturated fats, as well as monitoring our fasting blood glucose levels on regular preventive screening to make sure that we're under control. And physical activity. Physical activity, stress management, all of these things really have a lot to do with how our body produces insulin, how it uses it, as well as how we regulate it in our bloodstream. If diet and exercise isn't treating it well enough, or if the levels are too high, the physician may use medications to help the pancreas produce more insulin, or help cells use the insulin that is produced better. Metformin and glimepiride are two very common medications that you may see out there. If it's a type 1 diabetic and they just need insulin because their pancreas doesn't make any at all, or if the treatments that have been given to a type 2 diabetic are just not doing it and their blood glucose levels are just too high, they may require synthetic insulin replacement for the rest of their lives. This may be Lantus is an example of an insulin level. Concept applied. What is an MA to do? A lot. When caring for a patient with diabetes, there is a lot to take into consideration. We want to make sure they're getting annual eye exams, frequently checking their urine to see if there's glucose or protein showing up in there, if there's any kidney damage. Cardiovascular disease, they're mandated to have their blood pressure taken every single visit, and if they're not showing up every 3 months, oftentimes the physician will ask them to take home blood pressure, because 2 out of 3 diabetic patients will die of heart disease. They're so connected because of this circulatory system damage that occurs. You want to make sure they're checking their feet every single visit, even if they're there for a sore throat. Take off your shoes, let me check out your feet. You need to make sure if there's any sores there, because if they don't feel it because of neuropathy, that sore will get worse. Infection, amputation happens all the time. And make sure we're asking them if their medications are helping them, how they're doing, how they're feeling, how their quality of life is, because there's a lot that medical assistants can do as a patient advocate to make sure that they're getting what they need. And then follow them, make sure that you're invested in their care the whole time, because diabetics will need a lot, especially as they age. It becomes harder and harder to keep this disease under control. They need good medical assistants that are actively involved in their healthcare to support them.